Our next guest has spent a good part of his career studying global health policy and has written books on the subject. Dr. Jeremy Youde is the Dean of the College of Liberal Arts at UMD. Welcome back, Jeremy. Good to have you here.
Thank you so much for the invitation.
So one of the differences between 1918 and now is that the government response to that one was really at a local level. How does that change things in terms of what we're seeing today?
Well, I think you start to see a few different dynamics because ideally with the current situation, it should be led more at a national level. And so that should allow for more continuity. So we've got some more just shared understanding about how we should approach things. When you've got things like in the 1918, when it is very much on a local level, you see things like Duluth and Superior having very different policies, or Minneapolis and St. Paul having very different policies, and that leads to very different sorts of outcomes.
And Jeremy, the modern media must play a huge role in the response today compared to 102 years ago.
Well, it's actually kind of interesting because if you look back to 1918, part of the reason that we call that Spanish flu is not because of it originated in Spain or anything like that. It's because of wartime censorship that was going on. And so media was still playing a role, but you didn't have Twitter, you didn't have Facebook,
Sure.
You didn't have those sorts of things that were fanning some conspiracy theories or anything like that.
Mm-hmm. Are there some lessons from the 1918 flu that you think we could really be drawing on today, politically and globally, as we combat this pandemic?
Sure, there are a few things that come to mind. One is the importance of just having clear and consistent messaging, that you need to have messages that are shared from the top down, that they're being repeated, and so that people feel like, yes, this is coming from a trusted source of information. Second is having some sort of international coordination, because what happens in the US and what happens in Canada and happens in Mexico and happens in other countries, they're going to have an effect on each other. And when you don't have organizations or structures that can really help to facilitate that, it makes it that much harder, because we know that these diseases spread across borders. They don't care about the fact that there's an international border between the United States and Canada. So that's not going to stop the disease in and of itself. So you need to have those means of having some sort of coordination there.
How do you make sense of the human reaction to a pandemic?
It's to some extent, it's kind of understandable because it is something that it's mind-blowing. It's so unexpected. It's hard for us to really grasp. It's something that we can't even see, and here it's having all this devastating effect on our economy, on our politics, even just in our day-to-day lives. So it's understandable that people would feel uncertain or just not quite sure how to respond to it, and that's why it's all the more important that we have that sort of coordinated response and we have that trusted source of information that we can look to.
And I would sense a great deal of frustration.
Absolutely. I mean, I would love to be able to go to a movie or to go see some live music or go out and just hang out with my friends at a restaurant or a bar, and having to take those extra steps of, oh, can I actually do this? Do I really want to travel down to Iowa to visit my family? Well, they have different policies and different responses in Iowa than we've had in Minnesota, so that's had an effect on the caseloads there. That's very frustrating to have that extra step to think about how I'm going to conduct my life. And that's something that I think is shared pretty much across the country and across the world.
In terms of economic recovery, any historic insights that we could draw upon to kind of help pull our country out of this?
If we do look back to 1918, we did see a similar sort of economic drop that was happening in the aftermath of the flu pandemic. And so I think part of what is important is thinking about sort of the trade-offs that happen. That on the one hand, we talk about the costs that we're having now because things are shut down or they're not able to reopen in the same sort of way. But the more that we do now, the less that we have to do later. The easier it will be to try to restart things and get back into some sort of normal economic mode. So it really is about those sorts of trade-offs and trying to be ready and be prepared when we are able to resume relatively normal operations.
Mm-hmm. Is there another unknown, unnamed pandemic waiting on the horizon someplace?
Probably. In last year, the World Health Organization listed they came out with a list of 10 top disease threats, infectious disease threats, and most of them were things that we had heard of. The bottom one was disease X, and that's the unknown, and that's what COVID-19 is, and that there probably is something else that's out there. Who knows when it will happen? Who knows where it will happen? Who knows what it will be? And that's why it's all the more important that we prepare now, that we try to be as resilient as possible and have those systems in place so that when that next thing does happen, we're ready to have some sort of response.
Mm-hmm. I don't know how many people I've heard say that this is all just going to go away after November 3rd. Is it dangerous to to have people in their minds anyway tie this very clearly to politics.
It is, because while politics obviously play an important role in how we respond to this and what sorts of actions we might take, again, the diseases don't care about our politics. And so they don't have a stake one way or the other in the election. They're not rooting for one candidate or another. But what is going to be important is thinking about those sorts of policies that might come out and what we're going to be able to do to, say, support developing a vaccine, and then making sure that people get access to that vaccine if and when we're able to develop one. And politics will obviously play a very big role in that. November 3rd, though, is not going to be the make or break. It's not going to everything's not going to be different on November 4th with the disease.
Is it foolish to presume the next pandemic is 100 years off? So why worry about it?
I wish we could say it was going to be 100 years off, but it's unlikely. It could be next year, it could be 20 years from now, it could be 100 years from now. We can never quite predict these things, and that's why, again, having that sort of preparation ready to go just in case is all the more important and really vital to just have that in the back pocket.
Jeremy, has this spread quicker than the pandemic of 1918, simply because we travel around the world much easier than we did back then?
Well, you've got different sorts of things that are moving it. So with the 1918 pandemic, it was travel, but it wasn't travel because we were going on holiday or vacation. It's because we were moving troops going in to fight during World War I. And so that definitely has a contribution to it, but it's sort of the flip side of globalization. On the one hand, we love the fact that we're able to travel so easily. We're able to go to other places, but diseases and bacteria they travel with us. They end up as stowaways when we do those sorts of things. And they get to take advantage of it as well.
As we mentioned in the introduction, you're the Dean of the UMD College of Liberal Arts.
Yep.
Coming into the station today, we're on the campus. I can see that the students are back. How's it going so far?
So far, so good. Cross our fingers. We are in this first 2-week period. All the courses are being taught online. Students started moving back into the dormitories on Wednesday. Starting on the 14th, we'll have a variety of different modes of how we're teaching. And so we're all trying to figure out exactly what this is going to look like. We're not going to be able to have the same sorts of football games. We're not going to be able to have the same sorts of big orientation activities that we might normally have. But students have shown themselves to be really resilient. The faculty and staff have shown themselves to be really resilient. And I think we're all really excited about what this semester is going to have to offer.
All right. Well, Dr. Jeremy Youde, thank you once again for being here and sharing some of your real valuable insights with us. Appreciate it.
Thank you so much for the invitation.
Thank you.